Welcome to Huge Health, where we bring you the latest and most useful health-related information to help you live your best life. In this video, we'll be discussing how to cure neck pain along with the different types and causes of it. With so many causes and differing pain points, we will be going over the various treatment options and what can cause all the pain. Neck pain can be caused by a variety of factors such as poor posture, muscle strains or sprains, herniated discs, or osteoarthritis. It can also be caused by trauma or injury, such as whiplash from a car accident or a sports injury. The severity of neck pain can range from mild to severe, and it can be acute or chronic. Treatment for your neck pain will vary depending on your situation. Before we get into it, please take a second and smash that subscribe button and the notification bell so you don't miss any of our upcoming videos. Make sure and watch the whole video so you don't miss the cure for your pain. Here we go. Let's get into treatments you can try yourself at home for your neck pain right away. Number 1. Over-the-counter pain reliever. The first treatment you should consider in dealing with your pain is the use of an over-the-counter pain reliever. There are many choices such as acetaminophen, Tylenol, ibuprofen, Advil, Motrin, my favorite, naproxen, Aleve, and of course aspirin. Always follow the manufacturer's recommended dosage. After your OTC medication has had a chance to help relieve some of your pain, then you can take the next steps. Number 2. Heat therapy. Your next option is to apply heat to your neck. This step can be performed with an electric heat pad, heated neck massager, or you can simply dampen a towel with hot water. Focus directly on the most painful area. Applying heat will help increase blood flow, relax muscles, and reduce pain. Heat therapy increases blood flow by dilating blood vessels, which increases the flow of oxygen and nutrients to the affected area. This increased blood flow can help to reduce muscle tension and promote healing. Heat therapy can also trigger the body to stimulate the release of endorphins, which are natural painkillers produced by the body. Number 3. Ice therapy. Applying ice to your neck can help to reduce swelling, inflammation, and pain. Ice therapy works by constricting blood vessels and reducing blood flow to the affected area. This can help to decrease inflammation and swelling, which can in turn reduce pain. Ice therapy can also help to numb the area and provide temporary pain relief. It's important to note that ice therapy should not be used for longer than 20 minutes at a time to avoid tissue damage. A good option is to alternate from heat therapy to ice therapy in 15 to 20 intervals to help relieve your pain. Number 4. Stretching. After hopefully finding some relief from the previous steps, you can start to carefully stretch if you are able to. Take it slow. Carefully stretch left to right, forward and back, and hold the stretch for short periods to not cause yourself unnecessary pain. If you experience any sharp pain at any time while starting to stretch, stop right away. There obviously will be some discomfort at first, so take your time and be careful. When you stretch, you lengthen your muscles and improve your range of motion. This can help to reduce muscle tension and relieve pain. Stretching also increases blood flow to the targeted area, bringing in essential nutrients and oxygen that can aid in healing. Stretching can also help to improve your posture, which can reduce the likelihood of future neck pain. Number 5. Massage. Performing a neck massage can be a great way to relieve neck pain caused by tension, stress, or poor posture. Here are some steps to follow. Position the person. Have the person sit in a comfortable chair with their head and neck supported, or lie on their back on a massage table with a pillow under their head. Apply massage oil. Apply a small amount of massage oil to your hands and rub them together to warm it up. Begin with gentle strokes. Start with gentle strokes on the neck, using your fingers to apply light pressure. Move your fingers in circular motions, starting at the base of the neck and working your way up to the base of the skull. Use kneading movements. Once you have warmed up the neck, use kneading movements with your fingers to massage the muscles. Use your thumbs to apply pressure to any knots or areas of tension. Work on the shoulders. Many times, neck pain is also accompanied by tension in the shoulders. Use your fingers to massage the shoulder muscles and release any tension. Be aware, if your neck pain continues after performing these first steps, or is severe or chronic pain, it is recommended to seek medical attention. Seek medical attention. A doctor can diagnose the cause of your pain and recommend a suitable treatment plan. This may include physical therapy, massage, or even surgery in some cases. They may also prescribe pain medication to manage your symptoms. It's important to follow their instructions carefully and avoid any potential side effects or addiction. In addition to seeing a doctor, visiting a chiropractor can also be beneficial for treating neck pain. Visit a chiropractor. Chiropractors are trained to diagnose and treat musculoskeletal problems, including neck pain. During a visit, a chiropractor will perform a thorough examination to identify any misalignments or restrictions in your neck joints. They will then use manual adjustments, mobilization techniques, or spinal decompression to relieve pressure and restore proper alignment. This can help to reduce pain, increase range of motion, and improve overall function. In addition to adjustments, chiropractors may also recommend exercises, stretches, or ergonomic changes to prevent future neck pain. If further treatment is needed, your doctor or chiropractor may refer you to a physical therapist. Physical therapist. Physical therapists are trained to identify and treat musculoskeletal problems and can also help you improve your posture, flexibility, and strength. During a physical therapy session, your therapist will perform a thorough evaluation to assess your range of motion, muscle strength, and posture. Based on this evaluation, they will create a personalized treatment plan that may include exercises, manual therapy, and modalities such as ultrasound or electrical stimulation. These techniques can help to relieve pain, improve flexibility, and increase strength in your neck and shoulder muscles. Your physical therapist may also recommend ergonomic changes or lifestyle modifications to help prevent future neck pain. In summary, neck pain can be caused by various factors and can range in severity from mild to severe. Seeking medical attention from a doctor or chiropractor is recommended for severe or chronic pain. Visiting a physical therapist can also be beneficial for improving posture, flexibility, and strength. At home, over-the-counter pain relievers, heat therapy, ice therapy, and stretching are effective ways to manage neck pain. Remember to always consult with a healthcare professional before attempting any treatment at home, and follow their instructions carefully. We hope this information has been helpful for you. If you enjoyed this video, please share, hit the like button, and don't forget to subscribe to our channel for more health-related content. Also check the description below for helpful links and information. Thanks for watching, and we will see you in the next video.